So thanks for coming. For those of you that don't know me, I'm Sara MacDonald and I'm based in general practice and primary care. And I've done a couple of focused ethnographies, and I'm currently working on one with some of the people who are on this call. So I will mention that. It's a largely qualitative method, as you'll come on to see. So today, really, I just want to, for those of you who don't know anything about ethnography, just a quick reminder of ethnographic methods, and then what makes an ethnography focused, and then some kind of tips on how to. I probably won't speak for more than about half an hour, and then there'll be a chance to ask questions if anybody has got questions. So, for those of you who don't know much about ethnography, ethnography is very much a method that has its origins in anthropology, and the kind of stereotypical anthropological study. There's a sort of photo of that. It's like the kind of almost like a kind of intrepid explorer going out to cultures unknown and spending time trying to understand the kind of shared values, knowledge and beliefs and behaviours of those cultures, to think about social relations and power relations and hierarchies within that. And the key is that you really want to try and uncover kind of cultural understandings of everyday life. And those are both the kind of explicit, so the things that we do talk about, but also some sort of tacit understandings about the way that people do things and why people do things. And in the original sort of anthropological studies, the initial sort of rationale behind those was very much about description. So it was just about describing what was going on, rather than interpreting. But as ethnography has evolved as a method, then it's become much more about interpretation and being an interpretivist from an interpretative viewpoint. And in more recent years, and this is kind of where focused ethnography comes in, there's been an acceptance, a growing acceptance, that actually we can apply ethnographic methods to all societies. So even those ones in which we live and subcultures within our own communities. So the kind of the most famous, I guess, is Margaret Mead's work that was done in Samoa, and her book, Study of Culture at a Distance, very much tells you what anthropological ethnographies were trying to do, which was being the outsider, looking in, but actually trying to become an outsider. So Margaret Mead very much was a sort of a participant observer within these communities, and she was there for over a long period of time, over many years sometimes, and conducting field work and notes. And one ethnographer that I think has written some really great stuff and actually helps with focused ethnography is Michael Agar. And his book about being a professional stranger, he talks about how we can, what culture actually means, and how you can access culture. And so any of these books or papers are really helpful and useful reading material. So that's a little bit about the kind of principle of ethnography, but what about in research terms, in terms of what kind of questions we want to ask with ethnography and what are the methods? So it's very much about trying to find out what is going on here. And when we think about interpretation, why these things are happening, so why people behave in certain ways rather than just describing what's going on here. What's critical is learning from people within that setting, within that society, rather than you imposing yourself on that. A lot of that, certainly traditionally, is done through observation and participation. And so that is actually living within the communities. So obviously ethnographies do also go beyond these kind of traditional anthropological studies. So there are famous ethnographies of people who, you know, went and worked in care settings where they actually were a cleaner for the time of their field work, but nobody actually knew. There's a big debate within ethnography as to whether or not you should disclose who you are when you're involved in this sort of participant observation. There's a famous one about Glasgow gangs. There's ones about drug cultures and subcultures and those kind of things, trying to get a handle on things like knife crime. So there's a lot of those sorts of ethnographies, and a lot of those came out of the kind of Chicago school in the 20s and 30s. And one of the things that characterises those is this sort of time in the field. So you are spending time there, and it is an elongated period of time. And a lot of the data that you're collecting during that time are field notes, and it just is based on your own field notes. And I would say that in these kind of traditional ethnographic pieces of work, that the interviewing and discussion is a lot less structured than we might be used to in the kind of research that we do. And this meme here, I can't tell if it's ethnography or just hanging out. So it is a bit just like hanging out, but I don't know. Some people describe qualitative interviews as conversations with purpose. And I would say that ethnography is hanging out, but with purpose, that you're there, you know what you're trying to do. And so that you should always have that kind of at the forefront of your mind when you're thinking about ethnographic work. And other principles of ethnography is that they are, you know, there's an understanding that they're socially and contextually contingent. So you might be doing that ethnography over a period of years, and you might change your views quite a lot over that time. But if you went away and then came back, you might find completely different findings, and that's okay. There's the principle of having multiple data sources and different types of data. So it's not usually quantitative data, although some people do use surveys. You can also use documentary data. You can use, if you were doing a kind of case study ethnographic approach, you can use like local stats and kind of any sort of information that you can get on the area in which you're working. One of the key principles, and I will come back to this, is this idea of researcher reflexivity. So you're encouraged all the time to think about your own role in the description of this culture that you're attempting to unearth, and understand that there are different viewpoints, and people with different viewpoints may have quite a different understanding and interpretation of that data, and that's fine. It's okay for you to have different interpretations or different viewpoints, so long as you're kind of upfront and justifiable about that. As I say, I'll come back to that, but just to let you think that as a GP researcher collecting data, you might have quite a different approach to that data generation process than if you were a qualitative researcher, or if you had a psychology background, you might have yet a different view again. So it's being clear about your own professional background, where you're coming from and what you know. The other thing in the insider-outsider debate is whether or not you're actually looking at a community that you're familiar with. So if you were a nurse researcher doing an ethnographic piece of work and you were looking at nursing practices, then you probably have quite a different kind of insider viewpoint on what it is to be a nurse than if you were, let's say, a qualitative researcher. And there's a really nice, quite old piece now, but by Helen Richards and Carol Emsley, which is called The Doctor or the Girl from the University. And this outlines some of these kind of challenges of collecting data from a professional viewpoint. And the principle of description. So initially, these kind of traditional anthropological ethnographies were very clear that what they were doing was describing a culture as they saw it. But actually, when you bring in the idea of researcher reflexivity and knowing your place in the generation of that data, what you're actually doing is you're interpreting that data, or what you're seeing, you're kind of doing that as you go along and on the hoof, if you like. So there has to be a kind of acknowledgement that what you're bringing to this data is not just completely value free. There will be a values-based interpretation of what's happening. So those are the kind of ethnographic principles and data collection methods and questions. Focused ethnography then, I suppose, has come about really from kind of two sort of key departure points. And the first, I suppose, is that these sort of traditional ethnographic anthropological studies are now largely seen as objectifying. And, it's like that kind of Monty Python quote, "Have you met the poor?" It's a bit like that you are looking in a culture that you don't really have any place in. And I think our thinking in terms of research has moved on quite a lot. But also that these traditional ethnographies were quite unstructured, so they didn't really have a purpose other than describing a culture. And from that point of view, I think there was a need, to start to be more standardized or systematic in the way that data was going to be collected. But at the same time, there's a real recognition that ethnographic methods and their principles are really useful in a range of research settings. And these settings are almost entirely applied research settings. So they're used often in nursing, in healthcare. There are several ethnographic studies about the way in which care is organised in different hospitals or in acute care, or ethnographies of cardiac rehab, for example. And there's this kind of move towards what Keane has called technographies, which are truncated and shaped by the pragmatics of producing deliverables within a tight schedule. There is a sort of, I think, possibly unkind view that a focused ethnography is a sort of quick and dirty ethnography. So they're rather than you applying a sort of agreed and designed method, you're just trying to do ethnography on a shoestring, as it were. And so some people do view focused ethnography as kind of ethnography light. So there's a kind of a bit of a, well, I guess snobby, I would say, view that you can't really do a quick and dirty ethnography and just call it a focused ethnography. But I would argue, actually, you can apply the same principles, but you just don't need to do it in such an extended time period, I guess. So how different then is focused ethnography from ethnography? I think the answer is really they're no different. So they are the same. The kind of questions you want to ask are the same. The methods are pretty much the same. The principles are the same, but it's the focused bit, very obviously, that makes that difference. It is, rather than going to a community to say, let's just see what we're going to find here, let's see what we can describe in terms of the culture and the subculture, actually, what we're doing has a much more predefined purpose. And when I say a much more predefined purpose, I will again also come back to that, because it is predefined, but there is flexibility within that. And it's important to remember that there's flexibility within that. But it is the focus that's different. And so the focus is on a discrete or distinct problem. So in the study that I'll talk about a little bit, and that several of us here are working on, we're looking at the patient safety and the role of remote consulting in primary care. So it's how primary care has responded to post-pandemic reconfiguration, essentially, and what does that mean for patient safety in primary care? And so we were, I think, aware that obviously primary care had moved almost wholesale to remote consulting post-pandemic, and that we were also aware, as I'm in the Department of General Practice, that there was some disquiet, I think, amongst healthcare professionals about the kind of care that patients were getting in this newly configured system, particularly when it had changed overnight. So we wanted to look at this very discrete and distinct problem of how have practices managed post-pandemic in this reconfiguration. And the focus is also on discrete and distinct contexts. So we only wanted to look at Scottish primary care practices, but that isn't to say that that won't be generalisable to other settings that have also got remote consultation. And the focus is also on a discrete or distinct subculture or population. So with a traditional ethnography where people looked at entire communities, so they would go to, you know, to take Margaret Mead as the example, she was looking at adolescence and the coming of age in Samoa. Well, actually, here, when we do a focused ethnography in these kind of applied settings, it tends to be a subculture within the population in which you're already involved. So primary care staff and patients in Scottish primary care, rather than looking at the whole of Scotland or, you know, the whole of primary care. So that's where the focus is different. But in terms of the process and design, in practical terms, the timeframes are much shorter. So while in traditional ethnographic work, it used to be, you know, years potentially, here we have much shorter timeframes, and there are repeat visits, but those repeat visits, so you don't just spend your whole time, you know, in general practice. There are repeat visits, but these are very purposeful. So you're going with the purpose of collecting some particular data. And the data generation then is it is truncated, so it is more intense. While in a traditional ethnography, you wouldn't really limit the number of participants if you were looking at a community. Actually, you do limit the numbers, and this is where some flexibility can come in. So you identify key informants and people that you know are going to have the information that you need, and then you limit your data collection to those particular numbers of people. But also, because you've got shorter time frame and you're doing this on a shorter scale, then you do actually have to limit that, because it can't just be, you can't get everybody. So in terms of the questions that you ask in a focused ethnography, what you're really trying to get at still, as with a traditional ethnography, is the depth. You know, you really want an in-depth understanding of what's happening. And what I think a focused ethnography can allow you to do is to get at what's beneath the surface. So if we take the remote consultation study, we could actually just do a regular qualitative interview study and go and interview GPs. But it's the visit to the practice and the engagement with the practice and the ongoing engagement with the practice that will allow us to kind of harness what is it about this practice? You know, how does this practice operate? What kind of practice is this? We'll be able to kind of see that. So we'll get to the kind of cultural norms and values and beliefs. I mean, I've collected data in general practice before, and I've had GPs say things to me like, well, do you want the college answer? So, you know, people will give you an answer that they think they should give you. And I think spending time with the practice allows you to get underneath that and see past some of that stuff. And you'll be able to see really how things work in real life. So there'll also be an idea, I think, within a practice of how they're managing remote consultations and how that's going. But by possibly being in the practice, you'll see that when that doesn't quite work potentially, or if something goes wrong, or how do they manage that? And it's only really by being there with having your kind of ethnographic head on that you'll be begin to manage to see some of that. Sampling in an ethnography, in a focused ethnography, is not dissimilar to a regular qualitative piece of work, and the numbers are typically small. It's also purposive, but it's flexible. And so there is some snowballing within the field. So if you were doing a study, for example, on the experience of homelessness in Glasgow, you might have spoken to some people who, you know, run a hostel for homeless people, and they will say, well, we've got particular entry requirements in this hostel. For example, people are not allowed to drink if they're in this hostel, but you might want to speak to such and such a hostel where actually we don't stop people drinking. There, you know, there's complete acceptance. And so that would be finding out when we're actually in the field, who it's important to speak to, who these key informants are, and how, and where are we going to get the information that we need. The other thing I think it's important to say is that people don't necessarily have to be known to each other. So while with the remote consulting work, we're focusing in on GP practices, I'm also involved in another focused ethnography in Hull, where we're looking at cultural understandings of cancer. And we've brought people together who have, over the course of the field work and over the course of the visits, come to know each other, but they didn't know each other in the beginning. And so that's kind of like a focus group situation, but it's again, it's elongated amount of time with that focus group. And some people would say that they'd be going for a kind of sampling up until the point of data saturation, but actually, I think that we more likely now these days in qualitative research go for the idea of data adequacy rather than saturation, because some would argue that we would possibly never be saturated in terms of data if we're asking the right questions, but instead we've got enough data that allow us to answer our questions. And so we would go for this idea of data adequacy. In terms of data collection and generation, certainly within a focused ethnography, there will be some time in the setting. There'll be some time in the field. It doesn't have to be a long time. It doesn't have to be a long time all at once, but it's definitely not just a go interview someone and leave. There is some engagement with whatever setting that you're working in. And again, there will be field notes, and they will be used in terms of analysis. There can be interviews that will be formal, but also informal chats, discussions, you know, talking in the corridor. You can use documents, any kind of papers, as I've said. You can use, for example, you might be doing a focused ethnography of the role of community councils. You could have access to their minutes, you know, those kind of things. You might, in a practice, in a GP practice, have, you know, notes from practice meetings and that kind of thing. People often do what are called walking interviews, particularly when you're interested in the place. So what is it about a place that impacts on your health or whatever? So they, you know, you can walk around the neighbourhood in which you live and talk about that. And that's very much comes from an ethnographic point of view. And then within ethnography and focused ethnography now, there's a lot of use of creative methods. So you ask people to keep diaries, people take photographs, and all of this is used within the data collection process, or video content or whatever. And so all of that works within focused ethnography, and it's all data. In terms of analysis, you know, it won't surprise you to know that it generates a lot of data, particularly since you're getting these data from multiple sources. And just like qualitative work, the analysis is iterative and it starts from the beginning. And that's important because this iterative process or cyclical process that starts at the beginning allows you to begin to ask questions early on, and then informs the sort of ongoing data collection and sampling, as I'd mentioned before. So who is it that you need to speak to? Are we missing voices? Is there a big part of this question that we're not answering here, and who can tell us what we need to know? And then in terms of the actual practical looking at the data, it's the same really as qualitative data. categorizing, coding, looking for outliers, memoing, those kinds of things. And it's very much focused on the question though. So while in an exploratory qualitative study, we might just not quite know what we're looking for, within a focused ethnography, we've got a clear question, and during the analysis and the iterative analysis process, we just keep coming back to that question. What is it that's happening in this practice that's allowed them to all feel quite secure in their move to remote consulting, or in fact in a practice where it's not? And again, reflexivity will inform that analysis. So, we have a GP on our team, so when they're looking at the data, are they looking at it differently than a non-GP? And focused ethnographies are characterised by coding clinics, where we all sit down round a table with data transcripts and go through them and arrive collectively at coding frames, and that those change over time. And you can use NVivo or Atlas TI or any of these online data managing and data cataloging tools. You can use those in focused ethnography as well. And actually, if you're using data from different types of data sources, so the photographs and all of that, that can all be catalogued within NVivo as well. So that kind of helps with the management of that. So just to recap a bit then, on the remote consultation study, we're doing 12 case studies, 12 ethnographic case studies of GPs, GP practices across Scotland. And we're spending about 2 to 4 weeks per site, with the potential to go back to those. We will invite all of the practice staff to be interviewed if they want to be, and that includes reception staff, practice manager, nurses, all allied health professionals and GPs. We will, with their permission, sit in on meetings and observe what's going on and see what's happening. There will be, as I say, formal interviews, but they'll be less formal, just quick chats. We're interviewing staff and patients, so up to 6 patients from each practice. And then we'll also review the case notes of 25 patients. So all of that data will be used within the focused ethnography and analysed in our coding clinics as we go on. And so the kind of questions then that we're asking in this are very focused, but they are questions, I think, that we may not be able to answer with just a kind of regular qualitative study that went in, did some interviews and left. So, how have these practices adapted? What are the new procedures that we see in place? And it is about what we see in place. So practices will say, there's been a lot of media discussion about general practice being business as usual, but when you hear patients speak, they very much say that it's not business as usual. So what is the disconnect there? Can we explain that by visiting practices? Are they really business as usual? How much is that changing now in the kind of post-pandemic times? And the other thing I think that it's important is that we're going to be able to look at differences between practices and actually to try and get a handle on these different cultures within practices. And can we say which practices have adapted better than others? What is it about those practices where that's happened? I just want to say a little bit about reflexivity and rigour, because in qualitative research generally, reflexivity is the key, but that is knowing what we each bring to the situation. And I think if we're reflexive enough, then we can be sure that our research is rigorous. Our research needs to be credible and dependable. And one of the ways that we do this is by collecting lots of different types of data so that we can triangulate that data. So, does our observation meet with what the interview with the receptionist is saying? Do we see that there's quite easy access to appointments and they bring lots of people in face to face, or have they not been doing that? And we're able to triangulate that data against each other. And the other way that we do that is just situating what we do in the wider field. So we won't be the only people that are looking at remote consultations in general practice. Are we finding something different? And if we are finding something different, can we account for that? Can we say why that's happening? So some people would do just a single site focused ethnography, but you can do that within case studies. And so we're using 12, but if you read on focused ethnographies, you can see that people have done over other sites and doing different things in different healthcare settings. You can work in teams. Usually these are multi-professional teams, which is actually really helpful in terms of reflexivity. There's a really good example of a focused ethnography that was done by Helen Atherton and colleagues on remote telehealth and the introduction of telehealth, and they did it across the UK. And they worked in teams of multi-professional teams. I think ethnographies are really good, focused ethnographies are really good for making strong comparisons across settings. One of the things that you need to do within that, and which we'll need to do in the remote consulting work, is to have a kind of set of quite robust study documents. So although we're flexible, we want to make sure that we're gathering similar types of information in each of the settings so that we can have a holistic view of those case studies. And it's just really important to have frequent kind of in-team check-ins. Thought it'd be probably important also to talk about moving online, because for many of us, we've had to move our research online. And while on the face of it, you might think that ethnography is impossible online, there was actually a growing interest in digital approaches to ethnography even before the pandemic. And I think it is possible to do ethnographic work online. And so you are able to join online groups. People have done data collection on Facebook forums or patient forums or Mumsnet or whatever. And actually the data collection just really does align with in person. So you might decide that you wanted to do an ethnographic study of support groups. So you could join their online meetings, but then also interview people individually, go back to them, see if they've got anything online, if they've got meeting notes, that kind of thing. So it is possible to do it. It just takes a wee bit more thinking through, but you can certainly still do this kind of thing online. I should just say a little about ethics, because of the kind of flexible nature of it, and there's some question as to whether or not ethics committees will look favourably on it, because you do have to be a little bit vague in the way that you're writing this up for ethics. I don't mean deliberately vague. I just mean that I think that if you say we're going to do this and we're going to follow ethnographic principles, which does mean that we may be more informal in some of the ways that we approach people. I haven't had any trouble getting that through ethics at all. So you have to be, I guess, bound your kind of sample sizes, but say that you'll do between 8 and 12 interviews. And I think they're quite accepting of that, provided that you've built in the process for consent and informed consent. So I guess I have to talk about limitations, but for me, I think really it is just a matter of perception. So some people think, so those people outside of a qualitative paradigm think that this kind of work isn't systematic enough, it's not robust enough, and it's not generalizable. Whereas I would say that coming from a qualitative paradigm, I don't really set out trying to make things generalizable, but I do think that we often gather data across different settings that's typical. So we are able to say something robust and rigorous about the setting that we're looking at. But I don't think that we set out for generalizability. And I think so long as you're clear that you're not going for generalizability from the outset, that isn't really the aim of what you're doing, then I think that's fine. For traditional ethnographers, their main kind of concern is that there's just not enough time in the field. But I've taken this quote from Knobloch here, who said the focus on cultural understanding and the descriptions that define ethnography, rather than the form and amount of data, is actually what's important. So I think you can still abide by the principles of ethnography, and still have the definitions and characterizations of ethnography, rather than having to go and spend 2 years of your life with somebody. You can still actually get at that rich cultural understanding of what's happening within communities and subcultures. There's some references for people who want the slides, and that's me. If anyone's got any questions or thoughts, or there's not that many of us here, so yeah, I'm not. If you've got I've not got. I can. I can't see the chat box. Is there anything in the chat box? Because I'm sharing. Are you going to ask a question, Susan?
Yeah, I'm going to ask it.
Oh, is it going to be difficult?
No, but I just don't know if after listening to that, if I could really, I get the difference between a conventional ethnography and a focused ethnography. What I'm less clear about, is the difference between just a regular qualitative study that would use multiple sources of data and you would keep good field notes of. I'm not sure I see the.
Because it's the time and the setting, it's the observation is the bit that's different, and then the flexibility around your data collection methods and potentially sample. So while we might build that into a qualitative study, I don't think you would have to have that in a generic qualitative study. So if you think, so the remote consultation study has got engagement with practices as case studies over the course of a year, whereas when I went out and studied the rise in antidepressant prescribing, I contacted the practice, went for an interview, wrote up field notes. I interviewed more than one GP in each practice, but I wasn't really engaged with that practice in any meaningful way. Just went in and did it and then left.
True, but then there would be other, I can think of studies where we've gone in and done case note review and done interviews in the same place, and even just that almost accidentally, I guess. It's not really so much written into the design, but you come to quickly understand it or get a sense of a practice when you're sitting for days.
Yeah, yes.
Case notes. Yeah.
Yeah, and then maybe, if you read anything about focused ethnography, one of the big kind of proponents of this is Gina Higginbottom. She talks about focused ethnography a lot, and she says that she reads loads of things that call themselves focused ethnography that are not, but rather unhelpfully, I think she then outlines what the principles of focused ethnography are, but she doesn't actually say why these things that say that they're focused ethnography are not focused ethnography. So, I guess the thing is that study you're talking about, Susan, could have called itself a focused ethnography, potentially. Just maybe it didn't.
Yeah. Yeah.
Louisa?
I was interested in the slide towards the end that you said obviously one of the issues is generalizability. How do you argue with someone who says that then it's not very useful? What is useful if it's not generalizable? What can you take from ethnography that is useful?
Well, because I think even now, qualitative research, they will argue that it's not generalizable enough, and so therefore we're just doing a whole series of studies that are essentially Me Too studies. However, I think if you genuinely don't know anything about a subject, then what you're doing is you're providing some new knowledge, I suppose. You can confirm. So, if you think about the studies that we do in general practice around treatment burden, and we've got a whole series of studies that look at treatment burden in different illness conditions, and we find commonalities and differences. So it's useful to do that. And so while we don't get generalizable data, we do pretty much always get typical data.
Mm-hmm.
And so those, it's unlikely that you will find nothing that you can transfer to another context, I would say.
Yeah.
So and it gives you the depth. So you've got the depth and the potential to then transfer that to another setting. And what you might find is that it's not completely transferable because of the difference in population or whatever, but then you could argue that about, aggregated large, so if you take biobank studies, for example, there's a gazillion of those that tell us lots of different things, but then everyone will say that it's a slightly biased sample because there's, it's a bit more affluent and it's not very, it doesn't do well in terms of ethnicity, for example, in terms of representation. So,
Yep.
yeah,
Yeah.
you will come up against the generalizability argument your entire career as a qualitative researcher. And now I just get a bit annoyed. It's like, because you see, if you think about mouse models, so in mouse model studies, they're looking at like half a dozen mice. So nobody really talks about the really small numbers in mouse model studies, but they are really small numbers, and they're mice. So that's probably not a very good answer, but
no, I can see that. Thank you.
Anything else?
Sarah, I've got a question for you. I think I'm a bit intrigued because I used to work in addictions, and it was you talking about the studies like in addictions and in classical gangs. And I suppose I'm wondering, how do you keep that outsider perspective if the aim of this is to try and really get into those populations and those groups? So how do you maintain that position?
Oh, well, I think in focused ethnography it's probably easier, but the most famous one of Glasgow gangs, I can send you details of that, is that he didn't manage to do that. So he became completely embroiled in the whole culture, and it was very, very difficult. I think things like that, in addictions and things like that, or, gambling, or if you were going to do that kind of truly participant observation, it is ethically quite difficult, and I don't think people do that quite anymore. But I think in a focused ethnography, because it's not an elongated amount of time, and I also think having teams, so being able to work with other people so that you're checking in and debriefing and doing all that kind of stuff all the time, I think that's where it's most helpful. But I had a supervisor once who did an ethnography she was a cleaner in a care home, and her whole PhD was an ethnography and she was a cleaner, and she didn't disclose the fact that she was a researcher the whole time that she was there. And she would say now that was many years ago, and that she wouldn't get ethics for that now. You just wouldn't get ethics for that now. But it's just really interesting that they weren't aware that she was somehow different, or it's just, I think it's fascinating. Yeah, I think it's just I think working in a team and with people will be the thing that, and I'm not sure that all insiders really pull it off either. That's the other thing. You're probably quite different, from other people. Don't know if that helps, but
No, that's really helpful, because I was trying to figure out how you'd be in a Glasgow gang and not be in a Glasgow gang. And how you would be accepted if you weren't getting into the activities of groups. I
think that's difficult. Mm-hmm. I know that people, I know that there is a kind of issue around some of that, observing online fora and that kind of thing, and being, whether or not you disclose from the beginning that you're joining this group because you're doing some research. Because I know that some people just go on and sort of mine the data without saying that they're there for that purpose. And I think that's quite a tricky line, I think. But I think with focused ethnography, you have to be a bit more upfront about all of that and what you're doing. There's some great American stuff actually from the 20s and 30s about ethnographic insider outsider, like that kind of thing.
Thank you so much. That was really, really helpful. And the whole thing was really interesting. Thank you.
So anything else, or shall we go? So thanks for coming. Sorry, I strong armed some of you. Yeah, we'll see you soon.
Thanks very much.
Bye.